Thank you, sir, for joining. A very good evening and a warm welcome to our panelists. Our expert panelists, Dr. Jasmine Patil, sir, Dr. Adil Chimtanawala, sir, and Sudhir Makija, sir, and Mansi Karanjekar. And welcome to my co-moderators, Uma Natarajan and Partha Bhattacharya. Our observer, Nabamita, and our president of the Speak Magic Club and evaluator, Dr. Suryadev Majumdar. So this is our project, Ghar Ghar Homeopathy, which is undertaken as a project High Performance Leadership under the High Performance Leadership at our Speak Magic Toastmasters Club under the International Toastmasters. So let me introduce our expert panelists first. Our first expert panelist is Dr. Jaswant Patil. He is a researcher, speaker, and teacher, also a practicing physician with over 35 years of experience. He is a trained cardiologist and just trained in cardiology and chest diseases. He's a specialist, and his professional life has been about introducing integrated treatment protocols using homeopathy, allopathy, and other alternative therapies for providing holistic treatments. He was appointed as advisor to Government of Maharashtra on Ayush Task Force Committee on 2nd May 2020 to address the problem of COVID-19 prevention and treatment. Sir is also associated with research in integrated treatments at AIIMS, Delhi. Our second expert panelist is Dr. Adil Chimtanawala. He has done his MBBS with honors and DNB internal medicine from Nagpur University. He has done BHMS graduation as well as MD medicine with honors. He is pursuing PhD homeopathic medicine and adding more feathers to his cap. He is also author of 10 homeopathic textbooks. He has been appointed as mentor and PG guide to give complete guidance to postgraduate students in homeopathy by Hahnemann College of Homeopathy, United Kingdoms. He practices at Nagpur, Bangalore, Mumbai, and also globally through the online consultations. He received the Star of Homeopathy Award at the University of West London, UK. Further, I hand over the introductions to Uma Nataraj ma'am to carry on with the introduction of our next panelists.
Good evening, esteemed panelists and the moderators. A very hearty welcome to this panel discussion. So I would like to introduce our next panelist, who is our very good friend, Mr. Sudhir Makija. He is a sales expert, coach, author, and winner of speeches at various Toastmaster clubs. And he's an award winner in top pharmaceutical companies, and he's a storyteller too. We are privileged and happy to have you here, sir. Thank you. Then we also have our fourth panelist, Mansi Karanjekar ma'am. She works at Bharat Bijli Limited as Senior Executive Sales. She is a member of Delhi Junction Toastmasters Club and a very good friend of all of us. So a hearty welcome to you also, ma'am. We have our enthusiastic evaluator and president of Speak Magic Toastmasters Club, Dr. Suryadeep, who is a doctorpreneur, dentist, and he is the world's youngest dentist to speak on TEDx twice. We are privileged to have him here as our evaluator, and he's a confident communication coach too. So this is a brief introduction of our panelists and evaluators. We are expecting our third moderator to join us soon. He has just come back from office. He will join us. And I'm a spoken English trainer, and I live in Mysore. And I'm also completing my pathway level 5 and my pathway is motivational strategy. So we are collaborating this project and doing it together along with Dr. Rajeshwari and Dr. Partha Bhattacharya. Thank you. over to Dr. Rajeshwari. You're on mute, ma'am.
Yeah, my project Ghar Ghar Homeopathy, where we are going to conduct an awareness program of the emergency medical conditions. And this is the real life project which I have undertaken since last year, where I'm going to train around 1 million people and make the awareness program around the India and globe. So this is a panel discussion to create a medical awareness of medical emergency conditions and how homeopathy also works well in the medical emergency conditions. I am Dr. Rajeshwari Rapata, former dean and professor, and I'm a homeopathic consultant practicing since last 23 years. So today our questions start with our panelists. So I would like to ask Dr. Jasmine Patil, sir, about how emergency medical conditions can be made or propagated amongst the people to make them more aware of it, and how homeopathy works for the emergency medical conditions.
Good evening to all, and it's nice joining you all, educating people. Now, emergency is a very big term. Emergencies can be dire emergencies. It can be small time emergencies, which can land into the dire emergencies. So we have to separate out those. Basically, the person who is an homeopath, it goes even difficult for him also, even if he is an ace homeopath, not all the time, because there are no standard protocols in homeopathy as they are in allopathy. But when the remedy selection is right, and when the medicine selection is good and most appropriate, the results are rewarding and encouraging. At home, if there is an emergency, I would not advise anyone to start medicine unless and until the doctor is not available, or till the time the doctor is available. Now, this particular thing is for the general public. So many people, they know their self homeopathy, they can try, but they should not waste time, because when you land into dire emergencies, you do not know. Basically, what are the emergencies? It can be of brain, it can be of heart, it can be of abdomen, it can be general allergies which go to the severe extent. But whenever it is related to heart, one should not take a risk till the time he gets in touch with a proper homeopath or a cardiologist. He has to contact immediately. And first thing is that he should get diagnosed. Because in all emergencies, everything can give you time to treat, but heart emergencies usually don't give you time to treat. So in that case, particularly, whenever there is a chest pain, it can be a simple chest pain, it can be a complex disease, or it can be an acute myocardial infarction that we call as a heart attack. So in these cases, particularly in heart emergencies, I would like to say, if basically what I have seen in my practice, till the time you get an help, the safest drugs are Cactus G60 and Arnica 30 that anyone can use. They are not going to cause harm. Cactus G improves the circulation and it gives you time to reach to a cardiologist. And Arnica helps in dissolving the clot or improving the injury to the myocardium caused by the ischemia. And particularly for other heart conditions, one should, I respect and I want that they should immediately contact a doctor. For an allergics, there are so many things in the homeopathy, but homeopathy is more specific because the characteristic symptoms are most important. But till the time you get an help and you do not know anything, you are not getting in contact with homeopath or an allopath, whatever, wherever you wish to go, you should take one dose of Artica urens, that is 60 to 70% of the time, it has given a relief that is in 30 potency. Because it is in Ghar homeopathy, so the primary thing what needs to be taken care of should be addressed first. Whereas in the abdominal emergencies, whenever there is a pain and you do not know what the pain is, 60 to 70% of the time they respond to Colocin 200. But one should not waste time and not wait if the things are increasing. One has to know particularly when the emergencies will land up and where there is a break, where he should not go on treating himself. Considering the fever, which is most common, and every time the patient does not know when he should attend a doctor, I have seen the fever up to 200 and 102.4. They are the safest, provided the patient does not have history of any convulsions, any brain problems, because that is the most thing what happens. If the fever rises, the brain collapses. But that happens one in a lakh patient. So it is not applicable rule to everyone, and because of they must have heard some emergencies that brain bukhar brain mein chad gaya. So there particularly the fever should not go above 100 and they shall have to treat immediately. Bringing down the fever by just taking paracetamol is killing time. That is not an ideal way to treat, because fever comes to improve your immunity, stimulates the bone marrow to produce more white cells to fight against virus and bacteria. And therefore, usually the milder fever, I would say between 99 and 100, one can easily wait at home and in 24 hours, without any treatment, they can get well. This is called as self-limiting illnesses because it happens in those people whose immunity is strong. When the fever rises, that means there is always an infection which goes on increasing. And when it crosses 100 to 101, one has to be alert. And when it crosses between 101 to 102.4, there he has to search a doctor. By that time, I would prefer first is a homeopathy. Because if you get an homeopathy doctor for that and he give a proper symptom to the doctor, he can select your right remedy and the fever comes down within 15 minutes, half an hour. If it is not coming down, you have to again contact doctor and see that what best can be done. Because if the fever is not coming down after giving the homeopathic remedy, that means the remedy selection is partial or it is not completely matching to the symptoms. There, if you wait, the fever goes on rising because the immunity is low and fever starts rising. Above 102.4, you must contact the doctor and get it diagnosed because they are the less chances that they will resolve on their own. So this is small thing because there's so many panelists also to speak. There are a lot of things to tell about the emergency. I would limit
Thank you, sir. That was a brilliant answer, and it may be creating a lot of awareness. Whatever you spoke about the homeopathic medicines and the conditions where it can be given, that was a wonderful reply. I would ask Dr. Adil Chimtanawala for my next question. That is, what is your perspective about integrating Ayush system, homeopathy, into hospitals for ICU and emergency care? Dr. Adil Chimtanawala.
Yeah. Hi, good evening, friends. At the outset, I thank the Toastmasters Club, the Speak Magic Toastmasters Club, for inviting me here. My co-panelists, Dr. Jasmine Patil, Mr. Sudhir Makhinja, Mrs. Mansi, and you, Dr. Ashri. So, well, it has been my endeavor since past 23 years. I am practicing, and I'm practicing exclusively homeopathic cardiology at a place called Nagpur in Maharashtra. And when we started initially practicing homeopathy in cardiology, because after doing my DNB medicine, I shifted to BHMS, and then I had great interest in cardiology. So instead of doing DM cardiology, we did start this homeopathy in cardiology. So it was very, people were not accepting it easily. But I said, no, let it be. Let us start with things. So started with hypertension, and slowly and steadily it's developed into ICCU practice as well. And as modern medicine has an intensivist course, See, even after MD medicine, you need to be an intensivist to practice in ICU. So likewise, homeopaths need to be properly trained, because lots and lots of BHMS people are working in practically every hospital of the country. The core staff is BHMS, because they can't start practice immediately. So for earning or whatever other reasons, they join an ICU. They practice for 5 years, 6 years, 7 years, and they're so well trained with the machines. So whenever we talk about emergency practice, two things are there. One is auxiliary measures, uses of, say, ventilator, dialysis machine, blood gas analysis, central lines, etc. So once you have good hands on that, the only thing is now to integrate apathy, say homeopathy, into that branch and try to save lives. So it's a very welcome step. It will take a lot of time, although it may take a lot of time, say a decade or so that the next generation, we can start with homeopathic ICUs purely. Nowadays, what we do, like we work in, most part of my working is less of OPD and more in ICUs and more in ICUs and more with cardiac patients. So initially, it was unthinkable how homeopathy can be used only exclusively. So barring acute left ventricular failure and acute myocardial infarction, these two, many anginas, many other problems can be easily managed. So for that, we have prepared protocols. Why modern medicines one up and other medicines are down? Because they don't have protocol. But modern medicine is a protocol. Same thought we had applied in homeopathy. So once we develop protocols, we present them to the world, try it and out, so the things become easy, so we can settle down. So it's a very welcome step. Yes, teething troubles will be there, but over a period of time, the new generation will get a very big, wide scope of homeopathy in emergency practice. There are two types of emergencies: surgical and medical. Medical emergencies you can start with, and over a period of, because this BHMS is S, so S is for surgery. Over a period of time, even if you're not allowed to do surgery, but we can manage surgical emergencies as well with homeopathic medicines. But then that is going to take research, and that's going to take some time and training, a lot of training.
Yes, wonderfully said, sir. I agree with your answer that training is absolutely necessary. Even though thousands and thousands of homeopathic doctors are working as a core people in the ICUs and emergency wards and everywhere. I would and also, as you said, the surgery, post surgery and pre surgery, homeopathic medicines work very well. My next question goes to our next panelist, Sudhir Makhija. What do you say, sir? Do you think we need a reform? Health is my birthright and I will regain it. Because nowadays we see that the lifespan of the people has increased, but total medicine dependency has increased. So that has almost handicapped every person because of the dependency on medicines. So what do you think? We need a reform called Health is my birthright and I will regain it? You are on mute. Please unmute yourself.
Yeah. Thank you, Dr. Rajeshwari, for giving this opportunity. And I am really blessed to have such an expert, Dr. Adil, Dr. Jaswant, Dr. Rajeshwari, Uma Madam, Parthaji, and Mansi, and with other panels of this, other members of this. I'm also now learning a lot about homeopathy. So this is also real learning for me. Now, coming to the question, I feel that health, we all say that health, we only have one thing, which is health. That's the only wealth. But what I see is, as per the WHO statistics, it says that 1 out of every 6 people would be aged more than 65 years by 2050. And as the expectancy is increasing, definitely the chronic diseases might increase, hospitalization may increase. But I think there are a few things which are very important to take care. We only talk about right now, what we listen is, if anybody is suffering from a disease, he should be going to a medical practitioner, or he should be going to the hospital and he should get it treated in the hospital. But if I talk about a human being as such, if we want him to be healthy, then there are 3-4 aspects which, as per my perspective, it's not only physical, but it's say mental, it's also emotional. So if a person is balanced on emotional side, he is balanced on his physical side, and he is balanced on mental sides. If he is balanced on all 3 parameters, then only we can say that the person is healthy. And I'm sure if he is exposed to all the 3 parameters by, for example, if a person wants to improve his breathing habits, then a person who is trained in yoga, he can teach him how to breathe. Because most of us, those who don't know, we breathe from this part of the body, which is upper chest, if I'm not wrong. But ideally, the breathing should be from belly. So if I know that I am doing the right things on mental side, physical side, and emotional side, I don't need a medicine, and the expenditure of life would be a God gift. People will live happier, people will live more and enjoy the relationships. So this is my perspective to the question which you asked.
Thank you, sir. Thank you for that. Now, my next question goes to Dr. Jasmine Patil, sir. When we come to the medical emergency conditions awareness, and the common man is absolutely unaware of the things when you go to remote places, even in the cities. So, how can we make the people more aware of these medical emergency conditions, and how homeopathy is more effective for them? This is my question for you, sir.
It's a very nice question. I would start with sharing one of my experience. When I was an allopath and my own nursing home, I got a call at 4 o'clock in the morning. Usually the cardiac problems, they occur in the early hours of the morning. So, Dr. Saab, I am suffering from the gas and some uneasiness in the stomach. There was no chest pain. So I told him that this is not a gas. You immediately come down to my hospital. So he said, no, Dr. Saab, I have taken this particular soda and I am fine with that. And therefore, then I said, why did you call me? I said, to be on a safer side, I called you. So I said, safer side would be to come to the hospital. Otherwise, you will land into a problem, the time will be lost. As I always say, cardiac emergencies, we should not lose time. And at 7 o'clock, he came with a full heart problems and he has gone into an inferior wall myocardial infarction. And slowly the infarction started rising to the anterior wall. And in anterior wall, when it started rising, there was a drop of a BP. And that time in Jalgaon, we didn't have any cardiac cath lab facilities as well as emergency bypass surgery. So I had to transfer him to Mumbai in an ambulance with the drips. And I was doing a temporary pacemaker that time, putting it in, but there was not a need that time. So I just transferred him. But if he would have come right then, the whole procedure, first he risked his life. He was lucky to reach the hospital. Otherwise, most of the people don't reach the hospital. And then he was lucky because he got a proper treatment and he went to Mumbai. He reached safely. So, the emergencies, when they start, moment you start feeling with any emergencies, dizziness, you get vertigo, chakkar jaisa lagta hai, ya becheni lagti hai, and you feel weak from inside. Let it be any problem, one has to go and see doctor immediately. Because you do not know, you just don't theorize that I am getting this problem because of this. Because reaching in time is the best treatment for an emergency. So people should not waste time. And if they have someone doctor nearby, particularly a homeopath would be of great help. Even an allopath can also be of a help. But homeopathy, stitching time saves 9. Because I have seen patient who was getting a myocardial infarction in Corona time, he was not getting admission. And I just prescribing, there was no history. Dose of Cactus G60, Arnica 30 and Naja 30. By the time he reached the hospital, and he was he was sweating. So I do not know. I was sitting here online consultation. He went to the hospital, and they said, "You are lucky that you reached the hospital and you walked and came. It is a surprise for us." But that particular homeopathic medicine saved his time and did allow him to go into the very great complications. So moment you start feeling uneasy, from body tells you that there is something big problem in the body, and that is a time when you should immediately take a help of the nearest doctor. And the best part to go to a doctor, just don't go walking with any emergency, because you do not know what is there. You must always sit on a chair or ask the people to lift you up, and best position is lying down. If the car is there, back seat, lying down and reaching to a doctor. Till that time, if you get a help from a nearby doctor, or one, or like in allopathy, you get a sorbitrate, half sorbitrate under the tongue can help in cardiac emergency. If there is a pain, he cannot say, then barrel gun is there, or some injection if the doctor is available, or by the time he reaches to the hospital, if the doctor accompanies him or someone who knows. Now we require in a social life a properly trained paramedics who can accompany such people till the time they reach, and they should carry a emergency kit by chance if they get some problem on the way, because the time lost in the journey, even if it is 5 minutes, is very important. I remember I went with my maternal uncle to a marriage. He was sitting in a car, and when we had gone about 1 kilometer ahead, my wife called me, "You have forgotten your emergency box." I said, "Kisko lagne wala hai abhi? Jane do, I'm not coming back." She said, "No, you come back." So I came back, I took an emergency box, and then went. And after say 8 to 10 kilometers, he started feeling uneasy. And he said, "I want to vomit and go for a stool." And he went for a stool, and from there he came, he was just sweating. I saw his pulse, it was fast and feeble. I said, "You are undergoing a heart attack." So immediately that box was there. So I managed him and took him to an ICU, where his myocardial damage, heart damage was saved. And he was at a very mild damage, because he had already had a first attack about say 4 or 5 years back. And this is a time where we must form a homeopathic kit. I think Adil is very expert in that, and he's doing mostly a cardiology work. So we must have some emergency box where we can handle cardiac emergencies, abdominal emergencies, lung emergencies. The oxygen is falling. Carbo-Veg has saved so many lives in the patients. And this type of approach should be formed on a bigger platform, so that, the public awareness will increase. Thank you.
Yeah, coming to that point, sir, continuing with the same question, I'm coming to Dr. Adil Chimtanawala. Now, when we are talking about the emergency medicines and awareness, we saw that in the recent pandemic, even in the remote areas, people were not able to get the medical care, and some emergency conditions, they were not aware of things like CPR, first aid and all. We had seen that after the Second World War, first aid was like a revolution. The Red Cross had started the propagating about the first aid and teaching people, training people, and all that. Now, I think after this pandemic, it is also very essential that each and every person, the common man, should learn about the CPR, first aid, and knowing about the essential homeopathic medicines. As you know, it's very safe also to use certain medicines. So, what is your perspective about this?
Well, a very good question. And I'm seconding sir's view, Jasmine Patil sir's view. Let me tell you an interesting, since we're talking about emergencies. So way back in 2004 or 2005, my mother is a practicing homeopathic gynecologist and obstetrician. So we run a hospital, and she has been ever using homeopathy. I mean, like pre-op, post-op also, and deliveries and all, homeopathy was there. So we were called by government of Assam, that all the 7 sister states, Assam, Meghalaya, Manipur, etc. So what happens is they have remote areas, and people there are like the homeopath station there. So the main thing is they come for deliveries. So they called us that could you train our 300 to 400 MOs, medical officers, and the ANMs, the staff, to not to refer patients and treat them with homeopathy, I mean the gynecology patients. Because even if they're not able to perform deliveries, that's a bad thing. If you perform deliveries, is okay. But then with deliveries comes PPH and lots of other emergencies. So they should be able to manage and not shift every patient to this LSCS or to allopaths. So we went there, we trained them for about 5 to 7 days, and we gave them each a kit with indications like aconite for bleeding, fixed potencies. So even if you're mater medica, the knowledge of pharmacology is less, you don't know repetition, still as a qualified homeopath, you can use homeopathy and save that person till from place A to place B, because they're at that local level. And then we went to Assam, we taught them 5 to 7 days, whatever. We taught them basically kits, because it's impossible to teach them the entire skills. For skills, you have to need 3 to 4 months. When we came back, then next year, 2, 3, 4 years, we continuously followed. Were those kits followed? Were those homeopaths actually dealing with medical emergencies and gynecological emergencies and we found really a great success. So a similar program was held in Punjab. And then in Punjab, what happens is they have got ambulances. Like if you call an ambulance, if you're having a delivery and don't want to go to the hospital, you can call an ambulance, and that ambulance has got everything. So that ambulance also started having homeopathy kits with proper indications, one single medicine and indication of the probable emergencies. So that again, it was a huge success. Now talking about kits, this is the best method of like CPR. Suppose you are taking CPR camp. It's very easy to take CPR, tell them CPR camp, teach them CPR. But other than that, it's very easy to give them drugs like aconite, carbovec, belladonna, bryonia, etc. About 10 to 15 drugs, single potencies, because they will not understand the potencies. Low to high, 30 to 200, whichever potencies, and they work. So that will start creating an awareness. A very beautiful incident has happened on 5th of January. So like sir carries a kit, Jasmine Patil sir, we also carry a homeopathy kit. So we were coming from Mumbai to Nagpur, and it was first AC. So we were sitting, and suddenly the TT came. No, we started hearing odd sounds, a girl crying. And we did not know what was happening, why a girl is crying so much. Lady is shouting. So I went back to the toilet area, and the lady was lying there in a pool of blood. She was pregnant, and the baby was about to come out. Labor. She was in labor. Now my mother is a gynecologist, but my wife is a homeopathic pediatrician. So I told her that we did not even have gloves, but anyway, we started having, and the train had started. No one knew. First AC, this lady was dying, no husband, no one else to support her, and she was just lying. I said, where did you come from? She could not answer. Her BP we could not measure the BP, unfortunately, but the pulse was very feeble. We had China. So we started giving a pulsatilla, and with pulsatilla, the baby was out. Of course, the baby had already died because she was in pain, I don't know since how long. So we could deliver, but since it lost a lot of blood, we had given her China every 5 minutes, and from Mumbai to Igatpuri is the first stop there. We could save her, and till that time, I don't know from where, suddenly the husband came and the mother-in-law came, and then they took her to Igatpuri. So yes, even if you start managing acute conditions with homeopathy, that's one up. Emergencies, let it be for qualified people. Okay, fine. But acutes can be managed, any like neurological emergencies, strokes, cardiological emergencies. Let not be fear accompanying. Instead of giving allopathic drugs, start giving homeopathy, single drugs, single potencies, because people don't know. And moment they start getting confidence, yes, it is acted. I think we have won the race, and automatically, because A, homeopathy works, we know. B, it's very cheap, affordable, because nowadays in emergency, we have to see the cost. Cost is killing us. The entire pandemic has shown us that even the richest person, the cost kills you. The entire show of so many things, so many machines and all, is it really required? Yes, it may be required in some cases, but then yes, everything has to be paid for. And in homeopathy, in India, we don't have insurance facilities like they do on outside. So here homeopathy has a great scope. Only thing is needed is first training of the homeopaths themselves, and second, training of the public that to approach homeopaths.
Wonderful, sir. Very detailed answer. Yes, I also carry my homeopathic kit wherever I go. And I am fond of trekking and mountaineering. And I also carry my homeopathic kit, which has helped me a lot for the oxygen deficit we get at high altitudes. It's beautiful. And as you said, that homeopathy works very well in acute conditions, despite the people's myth that homeopathy works very slow, but it acts very fast.
One more thing. We need to organize researches and papers to be published in peer-reviewed journals of emergencies being handled with homeopathy.
Correct.
So the scientific community also invites us that, yes, please try acute left ventricular failure. Your allopathic drugs are not acting. Can you do something about it?
Absolutely.
So that is also an important thing.
Absolutely. Thank you for that, sir. Now, I would like to hand over the rest of the questions to Toastmaster Uma Nataraj ma'am and Toastmaster Partha Bhattacharya. So, Toastmaster Uma Nataraj.
Yeah. Thank you, Dr. Rajeshwari. We are getting wonderful information from both the doctors. We are thankful for that. So my question now is to Sudhir Makhija, sir. How can our education system inculcate awareness in children about medical emergencies other than the lessons in books? We just have some lessons in books about first aid and things like that. Other than that, the children are not aware. So how can the education system be revamped? Any suggestions from your side? You're on mute again.
I remember a school which is known to me. So in that school, there are 2,000 kids. So for the 2,000 kids, as I was speaking to the vice principal of the school, she told me that there is a nurse which takes care of the entire school of the kids. Whenever even a kid has a fever, before giving a crocin or paracetamol, the school calls up their parent or the doctor that whether we should give the medicine or not. So these kinds of things should be multiplied in not only in private school but also in government school also, because as per my knowledge is concerned, in Bombay itself there are 65,000 government school while there are 45,000 private schools. So they cater to more than 6 lakh, 7 lakh students. So I think that's the place where this education should start. Now, apart from this which is implemented, what I feel is, let's say, for example, vaccination is important. So if if I have taken the vaccination, my kid also will take the vaccination. Now, it's a general tendency that our parents, when they grow older, they are very much skeptical of not going to any doctor, because they feel that I am doing fine, I am eating right now, I have my food, I'm doing well, I don't have any problem. But if I go to a medicine or a doctor, I may get a lot of things because my old age is coming. So they have their own fear. So even for vaccination also, I have to convince my family to please take vaccination. So, but my kid, when he knows that he has taken the vaccine and he has not met with any kind of side effect, he can convince the parents or my grandfather or my mother or my grandmother it should be done. So childs are definitely angels. So if we teach them these things, it will be definitely going to not only their parent but their grandparents also. Now let's take about life skills. Like as we are talking about CPR, I have seen people being saved in India, in South, by a sister who knew about CPR, and she was able to save a life of human being. Every life matters on this world, on this planet. Similarly, there was one in Singapore also. So I think there should be some kinds of sessions. These sessions should be on life skills, like you teach kids about CPR. So I feel that maybe the adherence to that will lead it towards a positivity towards homeopath or towards the science which I feel should be talked about. So I think these kinds of life skill people should be, school should be taught upon. That's one of the way which I feel. Similarly, when there's an emergency, what I see that the seniors should have the mobile number. There should be a speed dial number. Whenever they are having this kind of critical condition, acute where perspiration is coming, they should be able to at least dial the number so that it goes to the right doctor, and the right action can be taken. So the kids also should be knowing, because they know how to operate the mobile much better than me or my grandparents or old age people. So these are few steps which I think should be taught in schools. There are a lot of things are happening up. This is what I feel from my side. Thank you, ma'am.
Yeah, thank you, Sudeepji, for that wonderful
Thank you.
suggestions which you have given.
Ji.
Yeah, we should have CPR sessions, demos sessions where the children are made aware of the medical emergencies, how they have to act, and also the speed dial numbers. They should have it in hand. I will pass the same question to Mansi ma'am. What is your suggestion? Like, how should the schools create an awareness in children regarding medical emergencies? What do you feel?
Good evening. First of all, thank you so much for giving me this opportunity. And I'm learning a lot from all these doctors now. I'm really happy. And thank you so much. From the bottom of my heart, I'm telling, I'm so thankful for being a part of this. Well, as far as answering to your question, today's children are tomorrow's citizens, as we always say. So, and children, they learn fast than us. They adapt to all the new situations, new conditions and all. So if we teach the children all these things, definitely it's going to help not only them, but even the people, parents or grandparents at who are in the house. They can help them to face the emergencies, or how to face the emergencies, or how to remain calm, how to keep them calm and all. By way of, like, you can have some campaigns, you can teach, give some training to the children on different situations, how to face it. Training and make them mentally prepared is very important. That's what I feel. Over to you, Uma ma'am.
Thank you, Mansi ma'am, for that. Rightly, you said that today's children are tomorrow's citizens. And if they are made aware when they are young itself, how they have to act during such emergencies, when they are taught, definitely they will be of help at home. And during emergencies, we can handle the situation better. Thank you for that. So now my next question is to Dr. Jasmine Patil. Medical emergencies are life-threatening always. And the way we react during those medical emergencies, it is something between life and death. And as a common man, now that the lifestyle changes are going haywire, we never know what emergencies we may have to face. So how do you think the common man can be equipped while facing such medical emergencies? You're on mute, doctor.
It's a nice question, woman. That what if the emergencies are going to happen? If we come to know very early, like if you remember, the crime always gives the dastak before it happens. The same thing happens with the emergencies. I would quote here one example of my own father. I was visiting Jalgaon 2 days in a week. I went there. I was damn tired by traveling and previous days already. And he told me that, see, मुझे यहाँ पे कुछ झुंझुनाहट हो रही है. So I said, this is not good. I said, show me your power. Everything was good. But even something, and that too when it happens at, say, the evening hours, 8 o'clock, people say, now the doctor must have gone, we'll see tomorrow morning. And this thinks the time is lost. Being a doctor, I recognize that there is some problem, but I could not make it out what problem can happen. But I thought that something will go wrong with the brain rather than the heart. Because I was a doctor, I could sense that. But I checked everything and everything was normal. Finally, I gave him some homeopathic remedy. And he said, Papa, you wake me up if you have got any problem. And at night, say around 1 o'clock, something happened to me, someone as if waking me up. I got up, I said, because that fear was there in my mind. So I went to my father and saw him. He was peacefully sleeping. So I thought that why to disturb him? He's sleeping quietly. I saw he's breathing properly. I didn't touch him because he may get the sleep disturbed. That is a mistake. That is a mistake. When you are in doubt, sleep is not important. You have to confirm, yes, you are right, and something you have come up with your intuitions from inside, you must act promptly. But I didn't act. That was my mistake. And then I went again and slept. At 3 o'clock, again, the same thing happened to me. Somebody waking me up. I said, what is this happening to me? So my subconscious was waking me up, saying, go and see your father. So I went there, I saw. And then I said, let me now touch him and see whether he's responding or not. So I touched him. He was not responding. I turned him to the other side. He was absolutely not responding at all. I pressed here painful parts. He was not responding. I said, he's gone in coma. And something has happened in the brain. Either he has suffered a stroke or something wrong with that. Now, at 3 a.m., because I was an homeopath and I was very confident about homeopathy, I started treating him with the homeopathic medicine, putting 4 or 5 pills on the tongue. 1 dose, 2 dose, 3 dose, nothing was happening. Finally, I thought that because of it, it might have happened that bleeding or thrombosis, the brain might have got swollen. So best thing to bring down the edema is Apis in homeopathy. And that 1 single dose of Apis, he is after say about half an hour, he started showing some signs of movement. And at 7 o'clock, he was fully awake. And I was continuously monitoring BP and pulse because it was remaining stable. I said, this is not time to get him admitted. Common man cannot do that, but they can check if now BP instruments are there. If the pulse is not fast or above 100 and if the BP is normal, then one should relax and try to call the nearby doctor rather than suddenly picking up and rushing to the emergency. At 6, 7 o'clock, he was fully awake. My other colleagues of my neurologist and everyone, I'm an allopath, so all of them know me. And they came running and they said, why have you not admitted in ICU? I said, my father has wished me that anything goes wrong, please don't take me to hospital. Let me go up directly. I don't want to go through the gadgets and the treatments. So I have to follow his wish, even though I am his son. And when he was fully awake, that time, his left hand was grade 0 power, not moving at all. So we started giving medicines, and the father, who was such an iron man, and he started crying. I never seen my father crying. And I said, what happened? I cannot live this life with my one hand and leg gone. Why did you give me medicines? I said, I have to give. I've given you only homeopathy, no allopathy. And then he said, then I don't want to live like this. I said, Dad, give me some time. Give me 1 week's time. I will find out a way. Then we took him to a CT scan. There was a thrombosis and big half part of the brain was infarcted. And it was a tricky situation. With this emotional thing, immediately a medicine struck to my mind, lakhs 30. Gave him 1 dose of lakhs 30. And next day morning, his toe started moving. And there was about, say, a 10% power regain next day. So it was not a TIA where you get a natural recovery. It was proved on the MRI that it was a thrombosis. Then gradually he started recovering, and at the end of 7 days, he had a power to walk with a support. Then I brought him to Mumbai at my house. And then we treated him here in the house. On 26th day, he was walking left and right on a Chopati beach. I said, Dad, walk here now. And this was integration, means this was the power of homeopathy, where I selected, because it is a respect, like Makija sir said, these old people, they don't want to go. They say, no, once we go, we'll find some disease and we are aging, we'll get some disease. Homeopathy is best for them because he lived till the age of 87. After that, he was alive for 15 years. And this recovery says that, yes, the emergency part, you have to be very alert. Before emergency happens, you get some indications from the body. And you should be alert even if it is late. You call a doctor or you try to, if you have your own general knowledge, try to figure out what may happen. And if that time, if the things have been settled, or I would have sat next to him, not went to sleep because it was too tiring for me, whole night's journey plus a previous day's OPD. And he said, don't worry, it happens many times and it goes. So what is my suggestion from this particular example? That Doctor Saab, mujhe gas ho raha hai, something pain here, don't waste time. Go to a doctor. Even if it is night, go there and come back. There is always a fear doctor may admit. Even if he admits, one day's bill will go, but you will be under observation. By chance, if you get something, then you will be in the hospital and you can be treated well. And if you don't want that, and if you are a believer of homeopathy, then you must have your own family homeopath who can attend to you like a general practitioner 24/7. And he is the best, he would be a best guide because all the super specialists may not be available, but at least he can be there. So you should have one expert homeopath and one general practitioner homeopath. That point is coming now that the many homeopaths who can tackle with such type of emergencies at the preset and train the people that, oh, you have got this, so you keep a watch. Suppose if this thing happens, you get a guidance from a doctor when to reach to the hospital, when to start, when not to start. But always remember, before any emergency happens, you start getting symptoms 12 hours prior to the emergency. And if you neglect those symptoms and don't get it clarified from a doctor, if you are not very well aware, then you may land into a problem. Thank you.
Yeah, thank you so much, Dr. Jasmine Patil. Like you said, we should be aware of the symptoms, and once our body speaks to us many times, and when we listen to it and we take immediate action, I think that will be the right thing to do. So I will pass on the same question to Dr. Adil also. You can just add on your views.
Yeah, thank you very much. As an extension of this corollary, and you correctly said, we are unfortunately not trained to listen to our bodies. And that training should start in the school level. Like in school, we learn so many things about precedents and geography and history and that. But how to manage stress, this is a basic thing is not taught in the school. Learn to, how to listen to the body. Forget about emergency tackling, it's a very, very big thing. But listening to our body, and then these complexes like I am fat and I am thin and I am beautiful, I am dark and all these complexions will not come once I listen to my body. I should appreciate. So this teaching should be there in our everyday household because this extrapolates in emergencies as well. So once we are teaching them for a common man, how do I know that I have landed up in emergencies? Number one is there are certain universal signs like ghabrat or anxiety in the chest. This is a universal thing. I am not feeling well. I'm not feeling up to myself. Something is wrong with me. Your body tells you, and you should listen to it and go to a qualified doctor or at least talk to someone. Speak it out. B, if you are already a diagnosed case of say hypertension or diabetes or ischemic heart disease, then you should know the probable complications you're going to land up with, and you can have probable medications for emergencies. That's very wise. For example, in allopathy, they have got sorbitate. In homeopathy, you have got drugs like arnica or something for that. Many things are there. So the doctor, your local doctor can be dealt with, can tell you. Now, the most important thing what India is fast losing is the concept of family practitioner or a family doctor. Initially, in the days of grandparents, there was someone called as family doctor. That doctor knew everything about everyone from the family. And if he needed a specialist opinion, he would guide the say a grandfather or the grandson, go to this person, get this thing done and come back to me. So today, 5 people are there in the family, 5 people have got different doctors, different specialists. So you're confused. Each doctor has his own this. So a family homeopath or a family homeopathic practitioner is actually a very, very good thing, because a common man is not supposed to know everything about the emergencies, but a local doctor, family doctor, knows everything about past, and so the predictability of the future of that patient is very well done by this family doctor. So I would endorse the concept of family physicians coming back to our country, where it can save lots of hardships, predictions can be much easier, because it's not possible to educate every single person, because everyone has got different mindsets and different stratas about any and everything. So that thing can be taken up by family physicians, and then the things can go forward. And family physicians are very trustworthy people. So that concept, if it goes forward, and if they are trained well in homeopathy, even if they want to practice allopathy, that's fine. But if they know something about homeopathy, they should know something about Ayurveda, they should know something about yoga and certain massage techniques. I think a lot of emergencies can be, and a lot of surgeries, unnecessary admissions can be taken care of. And by that, a lot of mental as well as financial hardships can be put to bay.
Yeah, thank you. Thank you so much, Dr. Adil. And we learned a lot from all of you. So to summarize, we should listen to our body, and even the schools should create an awareness or have some demo sessions. And we also should have a family doctor whom we can go to. Like olden days, they used to just feel the pulse and say, what is the problem? Nowadays, we don't have such experienced people, and we miss that family doctor concept. So like you said, it is always good to have a doctor who knows you, who knows what is your body condition, and they will immediately act when you tell them this is the condition you're facing. So we learned a lot from both of you. Thank you so much for that. And Sudhir sir and Mansi ma'am also, like you said, the child is the father of the man. No, so we when the child learns something, and the whole family also will be benefited. And children learn fast nowadays. We can learn a lot from them, and if they are well equipped, even the people at home, they are also benefited. So with this, I hand it over to our third moderator, Partha Bhattacharya sir. Over to you.
Good evening to all. I am so blessed to part of this program. I am learning a lot from these doctors. I am so grateful to all of you. It's my pleasure to giving opportunity to ask a question and learning from you. In the context of emergency conditions, I have few questions, because I observe many things in my factory. I am working as an engineer. In my factory, I observe that many people claim that they know about how to put off the fire, but in actual condition, they don't know how to use the fire extinguisher. In our home also, for cut injury, burn injury, we know all those things, but actually, when things happen, we're not able to apply our knowledge. There is a huge gap between knowledge and the skills. So how we compensate it? I want to know from Dr. Jasmine Patil. Can you please put the light on this?
Can you repeat your last part of your question?
Sometimes we have the knowledge, but we don't have the proper skill. How we apply the skill to resolve the problem? So how can we bridge knowledge and actual skill?
Yeah, it's a big challenge. It is not that easy. And the knowledge and skills has to be there. The knowledge can be given by the lectures, and skill can be taught by the practical training. Like I remember the BSNL at a Mela in Delhi, I was called in to give practical demo to the public that what happens if the person collapses on the road, what to do. And if particularly how to see the pulse, how to check the pulse, how to check the breath, how to feel the pulse here. That basic thing has to be taught. Without teaching, it is just it's a big jargon for a common man what to do, and he gets panicky because he has never seen emergencies.
Yes.
So there has to be a regular training camps at the school level, at the social level, at the society levels, in the factories where the accidents happen. And there a proper training program has to be done for what are the types of emergencies you are going to get and how to handle it. Now, I have already talked about the homeopathy, but I'm also, I just passed about 8 months back, another degree course of acupuncture. It's also a wonderful science. I thought that if I don't have any medicines with me, what is there? If I face an emergency, what is there? So there I learned many things. Like if you see a person unconscious, what you can do? You can give something strong to smell. And then if he wakes up, it is natural. If it is not, then take small needle. If you have spirit or no spirit, then just wash with the soap fast and just prick here or here. A drop comes out, or here on the ear lobule, drop comes out. You know how this works, but the doctors there in the training in acupuncture, they have shown the live cases, how they are getting well just with a prick, or just panting here on the elbow, rapidly beating like this. What you can do, what is available there, medicine is not there, no kit is there, nothing is there. So, you know, there are good techniques in acupuncture for that. And if you have an homeopathy, the basic 20 drugs, if they are being taught exactly where the emergencies can be used, like Adil said very nicely, that how to tackle, like he said, his mother's example where the kit was given for pregnancy and delivery. And so many lives were saved. Even if the doctor says, no, go for a cesarean section. I had told to one person long back when he had a problem with his wife that give belladonna 200 and colophylum 1 ml repeatedly. So belladonna dilates the cervix and colophylum contracts the uterus. That is required for a normal delivery. That is lacking. Therefore, normal delivery is not happening. If it is primary first delivery, what Adil said rightly, that pulsatilla works. So these basic things has to be taught. It cannot be imbibed directly by the virtue of his knowledge in his field. So there requires a proper training, and there requires to we have to produce a lot of videos for emergencies and circulate. Today we have got a best medium that, you know, short reels. We can just circulate. This happened, what you will do. This happens, what you will do. We do not have to go to the mob and teach them nowadays, because we have got a very good media how to control them and how to teach them. And this is how we should deal with the unskilled person who faces the medical emergency. Thank you.
Thank you so much, sir. Thank you so much, sir. Now I have a question in my mind that always comparison to village and town, village is always backward in terms of knowledge and all those stuff. If we compare, as a given example of today's example, today also people suffer from the snake bite. They also go to the, not going to the doctor, someone else, illiterate person. Why it happening? Why is the gap? How can he overcome this problem? I want to know it from Dr. Adil, sir. How can he overcome it?
Yeah, now each villages have their own problems and cities have their own problems. Villages nowadays are, I mean, many places they are developed, but still in the developing phase. Now, villages at the local level have got qualified practitioners, but they are not as qualified as the practitioners in the cities. And what trend which we have seen for the past so many years is people of the village, they do not trust their own doctors and they would run to the nearest city center. Then when the city is exhausted, the city people don't trust, they would go to a higher metro. Then the metro will be able to, like, so this is I don't know what trend is this. You don't trust your local doctor. You always feel that the doctor is cheating you or doing something, and they will spoil the case and they will directly run. This trend needs to stop, because your local doctor is your basic lifesaver. Having said that, again, it all ends up with school level or the primary education. Second, if there is a factory out there in the village, then you should know that there are burns cases, so you can should have a first aid. I was traveling, you will not believe, I was traveling from Mumbai to Bangalore, and a person had a heart attack in the plane. in the flight, mid-flight. And I told okay, I had my emergency kit, but then I asked for an emergency kit, first aid kit. So they only brought bandages. Just imagine, bandages in the plane. So even planes are not equipped with the kits. But where it comes with, like, if you teach the basic person about, as you said, gas, there's fire extinguisher. If you teach them that, then you have to teach them the basic first aid problems and the solutions for the various common problems, like snake bite, you said. For snake bite, there are no medicines in homeopathy. So you should know where to take homeopathy and when not to take homeopathy also. A. B. Second, this subject also needs the cooperation of local basic physicians, the general practitioners of your village level. In abroad, what happens is most of the medical practice is controlled by the government. In India, government is there. Even if I'm at medical college, most of the people will try to first go to a private practitioner. That's what we have seen. And then if nothing happens, then we'll ultimately go to the government college. Now, this trend also should shift. You should be equally distributed because India has a vast population. A, we should treat basic skill management of first aid and some basic emergencies like burns, like this and that. And you can't only give them option of homeopathy. You can give the option of 3 to 4 therapies and write it down. Write it down somewhere on the wall or something so that anyone can know, and then repeat it 3, 4, 6 months. Because whenever the emergency comes, it's a life-saving situation only. It's a do or die situation. So if you, and then other levels, like in defense services, in offices, you should have first aid kits and with proper drugs and their indications. So if you do this, a life can be saved. So it does not matter villages now or cities. A lot of villages are educated. At least they may not be educated as per the degree wise, but they are educated enough to save their own lives. And we should not underestimate our original Hakims. Unfortunately, because of the Britishers, our original system of medicine, the Indian system of medicine, was totally taken off course. Jhad Phuk bolte usko. It's wrong. No, India was ranked very high in medical system of its times. But unfortunately, after being governed by so many years, we now consider that original system of medicine as very inferior to the so-called modern system. That's not wrong. So revival of original systems of medicine, which is Ayush, has given a real big boost, and it should be propagated, and Indians should be proud of first using that. And if nothing happens, then go to the modern medicine.
Excellent, sir. Excellent, sir. I want to know the same question to the Dr. Sudhir Makias, sir, and to know what you feel about that.
Partha, sorry to correct you, but I'm not doctor. Mine, please, I just wanted to specify this. I think Adil sir has very beautifully answered the question. I completely go with. I think it's really what Adil sir has said. Everything has been covered. So I feel that there is only one line which even Dr. Jasmine Patil also said, that we have videos. So with this powerful media, we can make small reels, and if the contents are so good, then one reel can be viewed by lakhs, crores. Now, for example, I'm taking you all from this to that one video which has become viral. That kacha badam, pakka badam, what is that? It's nothing. It's just that guy is riding on a cycle and he's selling normal things, right? So that's the power of video. That's the power of it. Right? So sure, yes, I think, and I'm very much confident that if we come with these kinds of reels, definitely it's going to raise awareness of this beautiful science which we have, which is homeopathy, to lakhs and urban people which are there, not in India, but in higher. And last not the least, if I see the statistic for say around 1,000, it is said that for every 100 nurse in a hospital, there should be one infection control nurse who should be training them. But actually, what I see is in a hospital of 500 beds for 2,000 nurse, there's one infection control nurse. So that's the ratio for doctors also. So I think India is a vast population, so definitely these kind of doctors is required, definitely. And with this, it is definitely, I think it's a need of an hour. This is all from my side. Over to you, Paul.
Okay, thank you. Now, my next question to Dr. Jasmine Patil, sir. Sir, we have different emergency condition example in front of us, just like given the example of COVID-19, super cyclone in Odisha. So can we take the lesson learned from these things and we can spread among the largest population so we can avoid a different minor mistake from our side by which we can save many lives? It's a bigger picture. From bigger picture, we can take different lesson learned and how can we spread among the larger population to take it advanced leverage to save our life, many people's lives. How can I do it?
Artha, it's a burning question. And what Adil has said just now, that our age-old systems are being just wiped out, or they are not given importance, thanks to Modi ji, who is taking Ayush ahead and making every system and converting that into commission. I would like to share this, my experience during Corona time. You know, if you compare with the whole world, the best medical facilities were in Italy. There were maximum death. And worst medical facilities were in India and Pakistan, where there were maximum, very, very minimal death as compared to those countries. This is one question that one has to think. Because all these countries, like in Pakistan, there was Hakims and Unani system, very powerful. Here, Ayurveda and Homeopathy was there. And I have seen when the oxygen was not available, one patient called me, sir, I'm dying, you do something. There is no bed, no oxygen, nothing. At the oxygen of 60, I said, okay, if you can procure one oxygen cylinder, that would be fine. We can manage you at home, but listen, you are at risk because I am managing from a distance and something goes wrong with you, it will be a problem to you and me also. He says, sir, don't worry. Anyway, I have to die, either go there, I would prefer to die in your hands. I said, okay, that gave me a confidence and we treated. And that person recovered just with Carboveg and his heart problem, Kalicar and Bryonia. And that recovery was so fast that oxygen started coming within 1 hour to 70, 80, 90, it came. I said, 90 aaya to apan? Okay, Abhi. He is out of danger till the time he gets an oxygen. And finally, in 15 days time, he was with 98 oxygen moving. Now he was in village and the hospital beds were not available. So many patients who were in ICU not responding on ventilator. They were given last hopes where the permission was granted by the ICU head or a doctor working there. Those patients, the life was saved. I would say not 100%, but 8 out of 10 cases which I have treated, we got a success. And this particular thing, integration here in emergencies, like in Corona time has given lesson to everyone what is important in the life. What is important first is the health. If you have got good health, good immunity. Second, deaths were seen mostly, I would say, people were dying more out of fright. Now, I remember one patient, he said, I got a remdesivir, 40,000, then it went to 4 lakhs. Doctor, I got that injection, I started feeling better. I said, my dear, if you see all 30 countries on 30,000 patients, remdesivir was tested in the trials and it said it has no effect on virus. Then how this person survived? So, you know, this one person survived, gave rise to people using remdesivir. The faith created by the remdesivir saved them. Same thing in homeopathy. When the patient had a fear that everyone, moment you get a COVID, first fear comes, are मैं अभी survive होऊंगा कि नहीं? That is a fear of death was extreme, and fear of death, you take aconite 200 and the fear goes down. You may have to repeat it and fear goes down. Till the time you get an help. These are in the emergency kit. What Adil has prepared, emergency kit is fantastic. Because you know that till the time, and if the fear goes, the disease gets controlled, because fear suppresses steroid excretion from the adrenal gland, and therefore in allopathy steroids saved people, because of the fright the adrenal axis gets suppressed, which produces our internal body steroids, and they were lacking, therefore the patient was dying. So steroid support, later on it came after learning lesson from so many deaths, that steroids are working, nothing is working but steroids, and they were working, but it had all the complications of steroids. So here, when the proper integration of a patient, like the fever starts and you know that it is corona, and at the start those who have taken homeopathy, they have never landed into any problems. Maximum, I would say 99 out of 100 in my clinical practice. I'm not talking about any studies and done, and those studies need to be done. And then one will realize what is the importance at the primary if proper homeopathy is given. If the proper homeopathy is stitch in time, saves 9. There was one of my patient who is a cancer of lung with metastasis in the brain, liver, and bones. He came to me, and with chemotherapy he was not responding, immunotherapy he was not responding. I said, don't stop that, because they are doing some job. I will support you with homeopathy. Don't give up that. Slowly we will withdraw that. And that we did, and he slowly improved. But the corona time came and he was with the oxygen dropped to 70. So immediately when I got a call at night, I immediately said, go to my clinic. I always keep a man there 24 hours so that he can give medicines. And that medicines were given. And by morning, the oxygen was normal. And he survived. Now you have learned that diabetes hai, kidney problem hai, cancer hai. So if you develop corona, gone. No. You see this man surviving even with the corona. And here, if the proper integration of homeopathy would have been done with allopathy, we would have saved many lives. Even doctor, one who is a doctor, he is the owner of an COVID hospital. He also, when he got a COVID, he called me, I gave him medicine. I said, you give me the testimonial. And he gave the testimonial, yes, it is working. It is my own experience. I am the owner of a COVID hospital, and everyone should allow the integration of homeopathy with allopathy. And he has given a video. I had shown that video. It was posted on the social media also. Okay, at least it will reach to the people who are planning, and they will believe. And at least when there is no answer in the modern science, at least integrate on some patients and see yourself whether they are responding or not. And that should have been done, and that would have been a proper way. Thank you.
Wonderful discussion. In a summary, we have come to know that applying any skill need proper training and practice. Until unless we not practice well, nobody can apply the right first aid. At the village and town, the scenario is getting gradually changing. More doctor is getting gradually available in village, and everybody should have to be trust on the doctor available in village. The way we can change this condition. Otherwise, we always focus the town doctor, then situation will not be changes. And about the lesson learned, sir given a great example of ramicidine. How ramicidine, the concept of ramicidine changed the thoughts of the people. He is getting well. And the perfect integration of homeopathy and allopathy, how work as a magic during the COVID-19 period. It's a great learning for all of us. And this learning will help us in future to deal with such critical condition. It's a great learning today from this function. Thank you so much, all of you, for sharing your thoughts, your perspective. It's a all we are learning from this platform. Now I want to hand it over the session to Dr. Rajeshwari Rapata ma'am for sharing her
wonderful, amazing discussion going on, and really interesting. And it will go on and on. There is no end to it. And I would like to tell about the Good Samaritan law. Thanks for all the viewers who are watching us. I wish that everyone becomes a good Samaritan, gets skilled in the first aid and awareness of the emergency medical conditions, and the role of homeopathy should keep a homeopathic kit with everyone so that you can use it during the emergency conditions or as a first aid until the advanced care you get. So, to summarize all the panelists, it was an interesting discussion. So much of information was given. Hope the viewers get the benefit of all this. Dr. Jasmine Patil said about different experiences, even his personal experiences. That was wonderful. Good homeopathic medicines for emergency medical conditions were also explained by Dr. Jaswant Patil about the allergies, about the heart pain, about the abdominal pain, fever, how specific homeopathic medicines can work. He also explained about that. Also, he explained about the need to be trained people, how people should be trained for ICU. The doctors in the Ayush system should be trained for the ICU and emergency care. Dr. Adil said about the toothing problems, they will be always there, but homeopathy will come into mainstream in emergency and ICU. Further, balancing on the three parameters: the mental condition, the physical condition, about the physical condition, and socially also acceptable, becoming a balance between these three, how people can regain the health. This was the answer given by Sudhir Makhija. Dr. Jaswant Patil also said how the family doctor concept has to be adopted by everyone, and about keeping one homeopathic doctor as well as one general practitioner as your family doctor will help every person, every common man to get the help as soon as possible. And further, about uh, Mansi Karanjikar, she also said that children are tomorrow's citizen, need to make them aware of first aid and CPR. Also, basic things about health and body and listening to body is very important right from schools. This was discussed. Further, Dr. Jasmine Patil said about important of the social media for creating reels and for creating the awareness of the emergency medical conditions, the first aid, and how homeopathy can also work. All these concludes and to how the homeopathy can work wonders, can help in the first aid, and also creating the first aid awareness amongst the people, how to skill and train them. This is very important. So this concludes our session, and it was very helpful session, I think. And thank you very much for being here, our expert panelists and our panelists. Thank you, everybody. Thank you, viewers, also for watching us. Do post the questions on the live YouTube video so that we'll be able to address those questions in our next session. Thank you so much.
Thank you, doctors and panelists. We learned a lot from this session. It was a learning experience for us too. Thank you.
Thank you so much to all doctor and panelists. Thank you. We are really grateful to get all of you, to know from all of you. And it's really great pleasures for all of us because in our day-to-day life, it's very much important for all of us. Thanks once again to all of you to being here. Good night.
Thank you so much.
Thank you so much.
Thank you.
Thank you so much for that. Thank you very much. Bye.
Hi, good night.
Good night.
Good night. Live streaming is stopped, Rajima. You're on mute.
Dr. Suryadeep has to be present here for the evaluation. So that, shall we stop the live?
Yeah, evaluation can be done later.